Good day, everyone. Thank you for having me, and I'm actually glad to be here. If I may just begin the opportunity to start my presentation, let me actually appreciate the Nigerian Magazine, led by Kinde here and his team, for this opportunity and for creating this kind of platform. And most especially, I want to appreciate the diasporans for all the great things they've been doing for Nigeria, and more importantly, the Edo diasporans for the good work they've been carrying out in the state. So this opportunity actually gives me room for me to showcase what's been happening in the health sector. And I have some slides, which if you permit me, I would love to share. So that, I have my slides, I can share by myself, so I can run it.
Okay.
So, except you want to share on my behalf.
No, let me. Yeah, please go on.
Okay, thank you. Let me just give me a few seconds, I'll share. Yeah, thank you. By way of introduction, I am the Permanent Secretary of Edo State Ministry of Health. My name is Dr. Osamwonyi Irowa. And for the now, we are holding forth for all the higher levels of authority in the health sector. This presentation is given on this day of the Nigerian National Diaspora Day, and it's an opportunity for us to share the investment opportunities in the health sector with everyone. My presentation will be in this following outline, as indicated here, and I'll just run through so I can meet up with my time. Here is the map of Edo State showing how we are disposed. Looking at our boundaries, we have Kogi, Ondo, Delta, and partially Anambra State as our boundaries. And if you look at the Nigerian map, you can see our location gives us an edge which is unique to Edo State, whereby we are like gateway to other parts of the state or the country. Most of the persons coming from the northmost part of Edo State to go to the south-south, even the southwest, as well as the southeast. So that gives us an edge as a health system, as you find out as I do my presentation. To crown it and give us a good platform for starting this presentation, if you look at the vision of His Excellency himself, which he brought in the health sector as with the caption of Edo HIP, that's Edo Health Improvement Program. The overall vision, as highlighted in his own words, he indicated that Edo Health Improvement Program is a series of government-led interventions aimed at increasing access to efficient, effective, and sustainable quality healthcare services, with the center focus of improving the health status and well-being of citizens of Edo State and even every other person living in the state. So this actually gives us a guide as to what the passion of His Excellency himself is having for the state. By way of introduction, the health sector constitutes a vital component of this social welfare enhancement pillar, as already highlighted by the HOS in this earlier presentation. And Edo Health Improvement Program was adopted to achieve the vision of His Excellency, particularly at the onset of his first tenure. And as we started the second tenure, the mega agenda became more obvious to all of us, which is actually one key area the governor himself has seen as is going to an area to focus on in this second tenure. As you all would have known, the Ministry of Health facilitated the achievement of health vision in the state. That's the government's vision for health. And we are actually the ones that ensure that His Excellency's vision are put into implementation. The state is committed to universal health coverage, which is the only way to go if we are to have health for all in the state, and also by extension, what the country and the global atmosphere is looking at. And this is already being adopted in Edo State, where health services are made available, accessible, and affordable to all. As Ministry of Health, we have a mandate, and like you heard the HOS mentioned also, sorry, I will refer back to this overall vision of the state from time to time. So we are more strategic than ever before, rather than being transactional. So our mandate is to reduce to the barest minimum the morbidity and mortality due to communicable and non-communicable diseases, thereby significantly increasing life expectancy and quality of life of citizens of Edo State, which is actually key into what His Excellency had already initiated at the onset of his first term. And we have our vision also highlighted here, but I'll go on further to just go fast. The Ministry of Health has a structure which is currently as highlighted on this slide. You can see that the Ministry of Health, the health sector has a structure. The Ministry of Health, which is the policy and regulatory arm of the structure, has the Hospital Management Board, the Primary Healthcare Development Agency, the Health Insurance, and then the Traditional Medicine Board as implementing segment of the health sector in the state. Going further to just give you the pictorial look of what it looks like, we have the commissioner as the head of the health sector, the permanent secretary for the Ministry of Health, and other agencies and departments have the executive heads who are also coordinating them. And for the Ministry of Health, our major departments, as we have developed from the reform, like you heard earlier, the reforms have been since commenced, and we are already implementing most of the decisions of the reform, and they are actually very positive to achieving the goal of the health sector. So in the health sector today, in the Ministry of Health today, we now have 5 departments as against the multiple departments we have previously, based on the benefits we have derived from the reform already in place in Edo State and in the health sector. So we have public health department, we have planning, research and statistics department, as policy planning, research and statistics department. We have the regulatory or regulation and monitoring department, and we have another department which we term shared services that takes in many of the other departments, as well as then the capacity building and development department, which we have already adopted. So this makes things more efficient and effective for us to run as a ministry in terms of helping to ensure that our policy and activities in the health sector are achieved. The health sector, as you will see in the, sorry, let me just, the health sector, or looking at the national, looking at the health sector in the country and even by extension the state, we have the spend that makes it look like for you to survive in a normal health system, you need to have resources, financial particularly. And if you look at it, we have the private and the public. And in Nigeria and in Edo also, we have had the private sector having most of the spending, about 73% of the spending is actually from the private sector, whereas the public is about 27%. And if you look at the further breakdown of this, the out-of-pocket expenditure from the private sector is actually accounting for about 94%, whereas the public health, that's the public health, which is actually supported by the health insurance system as it is now in the country or in the state, is about 6%. And then if you look at the public health spend, you can see that donor-driven assistance dominates most of the public health spend as we speak. And the assistance from the budgetary provisions are actually very minimal, and which is about 20% that accounts for that. Then if you look at the trend of the graph on to my right, is you can see the trend of the budgetary provisions over the years. Although it has slightly increased, but it has almost remained below what the Abuja Declaration has indicated. And this is quite small for you to achieve good health sector in any particular location. Then the disease pattern in the country and the states as well, particularly in those states, you can see the disease pattern, respiratory infection accounting for significant as a single disease entity by 11%. And actually, if you analyze it further, you can see that infectious disease conditions are the main contributors to morbidity and mortality in the state. And that is not a very good outlook for you to achieve a good health sector. And most of these things we highlighted here are actually preventable conditions, which we need to work on. And looking at the trend we are moving towards, we are already approaching them, and we will need further commitment from all to be able to change this narrative as it is indicated now. The annual expense on the medical tourism is by global perception has been shown that Nigeria has about 1.5 billion expended on medical tourism, and Nigeria accounts for that percentage of global of about 1.5% of global tourism expenditure, and the key drivers that contribute to these include the high cost of similar procedures done abroad in Nigeria, the poor quality of healthcare, unexpected outcomes that also we experience here, and the poor infrastructure and inadequate personnel also present here, and the lack of medical equipment and shortage of doctors and other health personnel. These are factors that have contributed to the medical tourism tilting towards the Western world rather than dragging it back to our place here, which I believe Edo State has the privilege of having His Excellency on board for us to key into this opportunity with the support of everyone. Then the major conditions that people go abroad to go and treat are highlighted also. And if you look at it, cancer care, heart disease, even diseases that we can manage ideally here, such as diabetes and renal disease, are key issues that we all travel abroad to go and treat. And then noting also that the drivers include those of the costs over there, which is actually lower compared to what sometimes when we have to do them here. And then the quality of services, and then the accessibility, which we have a challenge here. So the major issues in the health sector, if you look at them, the diagnostic, lack of medical diagnostics in most of the areas, particularly in our state here. And then we have a lot of counterfeit drugs and substandard drugs in circulation, and we don't have ready means of being able to confirm whether these drugs are good or not. Rather, we just wait for therapeutic evidence to show that they are effective for us to be able to say that the drugs are good. I know what that means. That means increased morbidity and mortality in our system. Then we have issues of inadequate support facilities, even power, which is already known, and we thank God that the government is already addressing it to the largest extent, but still in a limited zone of the state. And then we have issues of potable water that can readily be, that is expected to be almost automatic for a normal setting. But this is a big challenge, particularly if we go to the rural setting. Likewise, the power issues. And then in the area of technology, we lack a lot of these up-to-date technology, which are even found in rural settings in the Western world and in better societies where the health sector is already functioning well. And here we have the dearth of facilities like even X-ray machines. Then when you go a little higher, CT scan and the other higher end diagnostic facilities are not readily available within our setting here in Edo State. And we have limited research being carried out. This certainly has to do with a lot of funding and also other challenges of the manpower and trainings that are available to us here. Then the absence of specialties that are necessary for us to run an efficient health system is a challenge. We have low availability of high-end specialties, and then for such as minimal access surgery, radiotherapy, and so on, oncology care, and the rest of them. Then equipment issues is a great one. Most of our equipment are extremely obsolete, and we have not been replacing them. And even when we have some of the equipment brought, we don't have power to make them functional. So these are challenges, equipment, and then coupled with the maintenance culture that is actually being very poor, and people don't have the technology or knowledge on how to maintain things. Then the manpower challenge has been very serious. Thank God it's been addressed already, but even then we still need to do a lot more, particularly as to do with the number, thereafter, those who have the appropriate skills to achieve what is desired in the health sector. On the Nigerian angle, you can see the budget for about total budget for the country. In the health sector is about, given to the health sector is about 4.2%, and this is supposed to be nothing less than about 15%. Then the healthcare spend, from the, look at it, it's about accounts for about 4.4% of the GDP. This is as at the time where the population was about, this data we are presenting is actually at the time the population was still be about 190 million, so about 2018. And then the healthcare budget for the country totally was just as highlighted here. Then the number of doctor to patient ratio was 0.38, which is pretty low compared to what the global standard indicates. And then look at the private healthcare spend also indicated there. And the total number of hospitals quite low for the population of the country, and also the skewedness of the spread of these hospitals. It's a bigger challenge than even the total number. Then the medical training centers are significantly few, even though they seem to be much by comparing it though with some other parts of the country. This is totally few. I mean, extremely few when we relate them to what we expected for the population we currently have. 46 is not too good enough. Then the hospital beds, as we have put in the country as a whole, account for about 192,709, which is also significantly low compared to what is expected for the population of Nigeria. Then healthcare spend I've actually highlighted before is more tilted towards the private sector driven setting. For Edo State, we have about 1,044 healthcare facilities, that's private and public inclusive. And this spans toward the primary, tertiary, and secondary health facilities. And we have less than 3,000 doctors in the state. And then this was at, with our population, which is already about almost 5 million, about 4.7 million population. Our population of pharmacists is about 500. We have just a little above 6,000 nurses. And then the hospital beds in public and private setting in the whole state are cutting across the 18 local government areas is at currently about 3,315. And this is not very encouraging when you look at what could happen, particularly during this COVID pandemic. We thank God we were saved as much as we did so much to prevent this from being utilized during the pandemic. So looking at what has been happening, the state has actually embarked on a lot of analysis of what challenges we've had in the health sector. And in doing that, we had 4 clear themes emanating, and to achieve the vision of His Excellency, we needed to start and actually prioritize. So I've highlighted here, based on what the work that has been done in the state with the support of partners in the state, to indicate that one of the greatest areas where we had challenges were the need for us to have better and upgrade of healthcare facilities. Most of them have been very bad and poor. Then we have issues of resources available for adequate human and material care in the health sector. Then we have issues of training, as the talent pipeline, whereby the number of persons trained in the system has actually gone down over the years, particularly when you go down to the nursing and even the middle cadre healthcare practitioners in the state. Most of the schools were challenged by way of losing accreditation in the past years. And as much as we're doing so much to get them back, that has been a big challenge. And then the issue of healthcare funding, which is a big one. Out-of-pocket expenditure account for so much. And then before now, we did not have the health insurance, and sustaining any health system without proper funding arrangements or healthcare financing is a big challenge. So these have been the 4 areas we noted as areas of challenge in Edo State. That's the infrastructure, human resources and other resources, then the talent pool, and then the financing of the health sector. So going back, the real challenges have, if you go down, if I key into the subheads are already highlighted, that you can see that if you look around, and most of us who are here, I mean, just for the information of diasporans who have not come around for some time, there we have dilapidated health facilities across the state. We have obsolete equipment. Our power supply has been very, very poor. And in the health facilities, including what happens in the general rural setting in particular. Then lack of electronic medical records. We have not embraced technology so much, and some of the reasons are not far-fetched. Then there is no easy access to water, even in the health facilities. And these are challenges that can actually feel the issue of infectious diseases. Then healthcare financing, like I highlighted, inadequate healthcare budgeting, the out-of-pocket spending by everyone. That brings a scale of preference to people when they want to spend. And that makes they most likely present themselves in the hospital when situations are very bad. Then poor healthcare insurance access in the state until the state health insurance was established recently by His Excellency, and to God be the glory, we are already kicking on that platform. Then the training institutions, for those who have also been following the trend in the health sector in those states, we have had the accreditation of the State Health State School of Nursing, and even the School of Health Technology. We had most of the departments either having no accreditation or partial accreditation. As much as we have tried to sustain that, it's not been too easy. And we have in these facilities, the facilities are actually very poor, and lack of modern equipment for teaching and for even training other persons. And then the poor access to technology, that has been a big challenge. And then funding to these schools have not been too satisfactory, which was part of why we've had the infrastructural and even the loss of the accreditation that we had for the School of Nursing. Then the resource available to the state in the health sector, we have had inadequate health personnel. Some of the facilities you may go to in the rural setting, we have very minimal number. Even if you have health personnel, most of them are not specialized healthcare practitioners. And then the worst part of it, or in the recent past now, is the issue of Nigerians, Edo in particular, people moving because they have a little capacity or have capacity to be absorbed into the greater society with enough funding. Then in our state, we certainly have, we really have a poor emergency services. The emergency services are very, very poor, and ambulance services are not too much available. Even when you see ambulances, they are used for alternative reasons. So the investment opportunities in Edo State. First, I want to categorize them into the public and the private sector. As a government and as a ministry, we believe that the opportunities are everywhere, because His Excellency, and in line with the global dream of achieving universal health, we have adopted One Health in the state, and if you look at what has happened and transpired in the last 2 years or 1 year plus, when we had this, since we have started this COVID pandemic, with the leadership of His Excellency, we have had a One Health approach to solving the problem of this COVID-19 pandemic in the state, and that has even given more insight into the best way to go when it comes to running the health sector. So looking at the investment opportunities, we decided to highlight this. In the public sector, the public-private partnership arrangement has actually been well embraced, and we are looking forward to a greater opportunity being taken here by all, including the diasporans, in terms of bringing technology to the states, such as that of minimal access surgeries, medical diagnostics, especially in the radiotherapy area or in the radiodiagnostic areas, and the rest, even in terms of the technology for running the day-to-day patient records, then in the public sector. And then in the area of infrastructure, the opportunities are abound also, whereby there are opportunities for people to take advantage of the infrastructural challenges that are here now, and then key in as a way of investment, either to build and operate, then even manage with the state, or adopt some facilities whereby the investor can also recoup these resources over time. Then in the area of equipment, this is not actually negotiable. We need modern equipment to run our hospitals. We cannot be doing things the old way and expect to get a different result. Modern equipment are needed in the areas of digital X-rays, dialysis facilities. There are so many of them. And if we actually find people key into this, resources can be recouped by them within the short possible time. So that there are issues that we believe that if we key into, will not just bring health to the people of Edo State and increase the life expectancy, we will also recoup our resources invested into this So in looking at the health sector, like I said, the private sector is another area that people need to just key into, because apart from the areas that we all know already, diagnostic centers need to be established in the state more than ever before. I know we have some in a few around in the capital or the metropolis, but we need them in all areas of the state. We have 18 local government areas. There are some local government areas that don't have one single diagnostic center. So these are opportunities that people can take advantage of. And the range of this the spectrum of opportunities in the diagnostic center is quite enormous. Can be minimally achieved with little resources, or with little resources that can be brought in by anybody, individuals, or even by a group of individuals. Then the state has given so much that can to the health sector to make it even very accessible to all.
Sorry, Dr. Irowa, to interrupt you. How long? 3 minutes?
Okay, fine. Yeah, 2-3 minutes. 3 minutes
Okay.
will be done.
That's fine.
We can build and operate and manage health facilities. We can bring in facilities for production of drugs and infusions in the state. Then we can bring technology that will help to run even private settings, and people will be able to pay for it. Then looking at why Edo State. The ease of doing business is actually has been made so exciting in Edo State. We have the PPP arrangement, which already most of us are already familiar with. In the Edo State, we have adopted e-procurement, which makes it easy for anyone to transparently access opportunities here when it comes to the health sector. And the state is strategically located, like I highlighted before, that all parts of the country can come here to receive health, and that makes it the possible next future for medical tourism in the country. And then the concept of One Health we have adopted. We already have existing health insurance, which means even if you build a private setting, you will have patronage based on the health insurance system that we're already operating. Then we have the access to proper lands and all that, the GIS, which you maybe most likely hear more about from the officer in charge. And then the registration and monitoring of health facilities, which the ministry coordinates. We readily make it easy for you to register facilities and also monitor them to be of standard. Then most importantly, there's political will by His Excellency to make things happen. Then what are the opportunities for the diasporans? I'll term it as a quick win or low-hanging fruit. In the primary health care system, which you have the Primary Care Development Agency, well coordinated. Now it's under one roof. That makes it easy with one interaction with the authority there. You can access primary care centers across the entire state without talking to different chairmen. So you can adopt a brand center and eventually recoup resources. Then the secondary facilities, we need equipment, ultrasound, CT scan, and the rest of MRI and the rest of them. And also other facilities that electronic medical record system and the rest. Then in the training institutions, we can also build hostels and make it easier for people to invest and all that. Then in medical records and telemedicine is already something that we cannot pretend about. Then the private sector, all of these things are also available to them. So in conclusion, the Edo State sector, health sector is a destination for investors, as there is room for all categories of diasporans to bring in their resources to invest, taking advantage of the opportunities already created by His Excellency and the strategic location of Edo State. Government alone, we all know, cannot do it, and we need everyone to be on board. So on that note, I want to once again thank everyone that gave, the Nigerian magazine and all the diasporans for this privilege and opportunity to open the doors into Edo State health sector for investment. Thank you.